Today I took a peek at the New Mexico Cancer Center located here in Gallup and talked to some interesting people and learned some neat things that this facility has for Gallup. Just want to point out a couple things and then we'll get into the video and look at the Cancer Center and some different aspects of it. But the cool thing about the Cancer Center is it's allows people to get treatment that they would have to go to Albuquerque or Flagstaff or somewhere else to get. And with cancer treatment, that could be a real pain because it's repeated doses of either radiation or chemo. And not having to travel or stay somewhere else is a pretty big deal. So I've come to realize what an asset the Cancer Center here in Gallup is to the people here. Now hopefully I'll never be a patient there. But the odds are that I or someone in my family will be. So it would be good to support the institution, or at least understand a little bit about what they do. And that's what this blog's about. Check it out.
Hello, my name is David Telfair. I'm a registered nurse and I'm the administrator for the New Mexico Cancer Center here in Gallup. This facility that we're looking at right now is our Hogan that was erected at the time of the construction of the Cancer Center. The Hogan is available for ceremonial use on a per request use, and it is free of charge. There's no radiation in the room except for when the linear accelerator is turned on. And you know, cancer is such a frightening disease many times, and then coming into a room that is as fortified as this, we thought it would be nice to have some familiar and beautiful paintings. So we hired a local artisan to paint murals on our walls to make things a little more appealing and less frightening.
Cool.
It's called a linear accelerator, and it emits radiation, high energy radiation, and it can be very precise using a device called a multi-leaf collimator that makes the radiation conform to any dimension that we want. We can treat something as small as a centimeter to something as big as several centimeters. But at the time this machine was purchased, it was state-of-the-art. Since then, other multi-slice CTs have come along, but we use this machine strictly for treatment planning purposes, which is more than adequate for that purpose.
My name is Emery Naminha. I'm one of the nurses here at the New Mexico Cancer Center. I've been working here for 2 years. Zuni background, it's really been helpful for the Zuni people that come from the reservation, that they find somebody that can speak Zuni with them, tell them about the treatments, tell them what to expect, how they're going to feel if they do get chemotherapy or any of the other treatments that we do here. I just want to say to the Zuni people, Keshe, that they are welcome here anytime, that they have any questions to give us a call, and that I can talk to them as best as I can to speak to them in their own language, in our own language, and so that they can have the information that they need.
We want to be culturally sensitive to what their needs are. We want to be centrally located so they have good access. We want to be able to communicate with the people that they trust for their care. They may have a family health provider, a family practitioner. Just because you have cancer doesn't mean all of a sudden that person's out of the loop. We continually communicate with your patient, your doctor, your nurse practitioner, your provider, and let them know how you're doing. And we also coordinate care with them so that it's not fractionated and, well, we do oncology here, don't talk to us about anything else. We're here for the whole patient.
Okay. I'm Merlene Arthur. I run the lab here at the New Mexico Cancer Center. I speak Navajo, yes. I'm actually the only translator here. I have some just Navajo speaking only patients.
Cool.
And then I have to translate for them.
My name is Kathleen Houlihan. I'm a lung cancer survivor and a volunteer with the American Cancer Society here at the New Mexico Cancer Center in Gallup. I'm a 2-time lung cancer survivor. I was diagnosed with inoperable stage 3B lung cancer in 1999, and I had a complete recovery from that cancer. And I was diagnosed again last year in 2009 with a stage 1A lung cancer in the opposite lung. And just last week, I learned that I'm in remission from that cancer as well.
So like I said, Kathleen is our miracle. We have a couple of miracle ladies around here. My name is Joyce Graves, and I'm a volunteer with the American Cancer Society. I am actually a 3-time cancer survivor. I've had breast cancer twice, and I've had skin cancer. And we volunteer here. Our office is in the New Mexico Cancer Center, but we are associated with the American Cancer Society. They are here to stay. They're wonderful. Patients get the best treatment that they can get here. When Kathleen was saying, before people had to go to Albuquerque, I've been diagnosed twice with breast cancer. And unfortunately, it was before this wonderful facility was here, so I had to go to Albuquerque for my radiation. And that meant you either drove back and forth every day for 7 weeks, or you stayed over there, which is very difficult, to be away from family, to be away from home. So just because this place is here, people won't have that burden also. Because when you're fighting cancer, that's about all you can do. You can't think about driving every day to get your treatment. So it is a top-notch facility. They have the best oncologist here, and the staff, again, is wonderful. If we're interested in volunteering at the Cancer Center, just call up here at the New Mexico Cancer Center and they can give you the information. We'd like to open more than 3 days, but for right now, that's how we're open. We go back to the chemo room and talk to patients. We give them support. If they need any of our gift items, they're available. We have pamphlets if they have a particular type of cancer, they're not sure what it's all about. We can give them that information. And we just give them support. We've been there, we know what you're going through, and we can help you through this.